Should the United States raise the minimum age to buy electronic cigarettes from 18 to 21? The debate is firing up after earlier this week, the country's largest doctors group made a resounding recommendation keeping any tobacco products out of the hands of young people. Lisa Voyticki has more.
The American Medical Association wants the minimum age to buy e-cigarettes to be raised to 21. New York City's doing it, 5 dozen towns in Massachusetts are doing it, and 8 towns in New Jersey are doing it. So what is stopping the nation?
E-cigarette use is exploding amongst young people.
The CDC says e-cigarette use among middle and high school students tripled from 2013 to 2014. Part of that has to do with its marketing of different flavors and sugars. Attorney Karen Blumenfeld is the executive director of the New Jersey Global Advisors on Smoke-Free Policy, also known as GASP.
90% of all people start smoking before they turn age 21. So if governments can reduce access to these products for young people, then hopefully that will reduce initiation.
Dr. Susan Brill is the chief of adolescent medicine at St. Peter's University Hospital. She says since e-cigarette cartridges contain nicotine, it can make them just as addictive as tobacco products.
It's like a direct way of exposing the brain to nicotine, and I'm concerned that this may be what we call a gateway drug. So kids who are experimenting with e-cigs may then say, okay, now we're going to go smoke cigarettes. I think the initial e-cigs were perhaps thought of as a means of helping adults quit smoking, but what's happened as they've become more prevalent.
In New Jersey, the Senate passed legislation raising the minimum age to buy e-cigarettes from 19 to 21, but it has not been posted in the Assembly. And according to the nonpartisan Office of Legislative Services, in the first year of being enacted, the state would lose about $19 million in revenues.
One has to realize that there's disposable income that will not be spent on tobacco, that will be spent on other products that do have a retail tax that the state would collect. In addition, the state spends over $3 billion a year on healthcare costs related to smoking and smoking illness.
NJGASP says if the age of sale for cigarettes was raised to 21, nationally it would save 220,000 lives. The FDA is expected to announce a decision on its proposed regulations of the e-cigarette industry in the coming months. Reporting in Summit, I'm Lisa Voyticki for WMBC News.